Hello, Dr. Nathan Stickney here, and I'm going to discuss stress fracture diagnosis and treatment with you guys. Stress fracture is one of the most common conditions we see in the foot and ankle. It generally happens in one of your metatarsals 2, 3, or 4. What happens is due to abnormal stress, whether it be the biomechanics of your foot or just overuse, you overstress these areas. Those metatarsals fill up with what's called marrow edema, and then once they can't handle any more marrow edema, they form a small little fracture or crack in the bone. Now, how we diagnose stress fractures is mostly by a clinical diagnosis. Your podiatrist can do a good clinical exam that will be able to tell if you have a stress fracture or not. Other imaging is often done. We always want to take an x-ray. Sometimes the stress fractures will show an x-ray, sometimes they will not. Other times, if it is bad enough, we will even order an MRI, which will always show us if there's a stress fracture or not. Treatment for stress fractures is simple. Rest, ice, and the main thing is immobilization. By offloading the stress, your body will heal the stress fracture on its own. Sometimes we'll give you a prescription for some supplements to kind of aid your body in healing that, but the main thing you will get is a walking boot. Every time you walk and you push off with the toe, that is putting direct stress on these metatarsals, causing your stress fracture not to heal. So the boot will completely offload these. Combine that with icing, rest, and your stress fracture will be healed in no time. Yeah. If you enjoyed this video, please smash that like button and subscribe.